Hi, I am Hans van der Zeer. I am a specialist surgeon for dogs and cats. This video is about Luna, a 9-month-old Rottweiler that had a crippling disease. Over the last month or so, she has stopped playing, her movement has become uncoordinated, she has become weak, and her muscles were not developing normally. Luna was referred to us for evaluation and possible surgery. In the slip one can see her incoordination. Another symptom is that of her tail that is tucked in or moves only due to the momentum of her swinging body. These symptoms are often described as that of a wobbler, a collective term for abnormalities of the spinal cord, of the neck, where there is pressure on the nerves going to the legs and body, and thereby interfering with their normal functions. In this slip, one can see that she actually collapses when she tries to squat to urinate. This is due to the weakness in her legs that cannot support her body weight. When she does get up, her legs are all over the show and show severe incoordination. One can also see that the tail is tucked in and only moves with the swinging action of her body. When she tries to sit down, her body is not aware of the position of her legs until the final movement when she sits down. There are a number of conditions that can cause the same symptoms that are seen here. The most common condition, especially in young, growing, large breed dogs, is some abnormality in the spinal canal that causes pressure on the spinal cord and thereby impairs the function of the nerves. This causes abnormal function of the legs, such as weakness and incoordination. In the next section of this video, I will demonstrate some aspects of the anatomy of this case and the procedure that was done to correct the problem. The first step to diagnose the problem is usually what we call survey radiographs, to see if one can see any abnormality in the shape of the vertebral canal. In Luna's case, we could not immediately see any abnormalities. The next diagnostic modality can be either a computed tomography scan or a magnetic resonance imaging scan. Due to accessibility, a MRI scan was done to evaluate the spinal cord. The MRI scan gives very useful information, especially about the soft tissues that cannot be seen on X-rays. In order to visualize the normal and abnormal anatomical structures, one must get an idea of the orientation. In this picture one can see the ears lying on the table, so all of the structures are upside down. In this picture, the structure of the vertebral body is shown by the different markers and shows the body of the vertebra, the sides and the top. Here the spinal canal is demonstrated. On the inside of the spinal canal is a very white signal. This is a layer of fat which suspends the spinal cord and allows movement of the cord during activity or movement of the neck. Here the spinal cord is demonstrated, that lies as a nice round structure suspended by the fat in the spinal canal. This slice was taken at the junction of the second and third neck vertebra. One can see that there is the absence of the nice round spinal canal and the round spinal cord. This is due to abnormal development of the vertebrae at this point. What is demonstrated here is that the articular facets or joints of the vertebrae are abnormally shaped and are pushing to the middle of the canal, thereby pushing onto the spinal cord and showing the hourglass shape of the cord. This is the third neck vertebra of a dog, showing the different anatomical aspects. On top are the articular processes, then the spinal canal and the spinal body. This is just a side-on view showing the second and third neck vertebra. The second vertebra is also known as the axis. This slip shows the abnormally shaped articular facets pushing onto the spinal cord. This head-on view shows the same picture, and one can visualize the obstruction in the spinal canal and pressure on the spinal cord. One particular aspect of the anatomy that was quite important in this case is that at the back of the second cervical vertebrae there is a big area where most of the neck muscles attach. This is also an important ligament that supports the head during normal movement attaches here. It was important to maintain this connection with the muscles for the best recovery. In the next part of this video, I will describe a novel approach to expose the abnormal articular processes while maintaining the normal anatomy of the neck. Usually when these abnormal bony projections are operated on, the bone above them is drilled away, thereby leaving a large defect that can create problems in the healing phase. In this case, the top or the roof of the second neck vertebra was opened up by carefully sawing the sides and top of the roof and hinging that part back on the joints behind them. Before the surgery on the top could start, a ventral fusion was done. This created stability of the vertebrae while working at the top and was also important for long-term stability of the site. During this procedure, the disc material was removed, a small titanium cage was placed to keep the space open, and a special locking plate was used to stabilize the two vertebrae and allow them to grow together. These are the lines along which the vertebra was cut at the top. The roof was then loosened and pushed backwards to expose the spinal canal. This is a representation of the abnormal articular facets as they lay inside the spinal canal and pushed onto the spinal cord. These abnormal projections were drilled away with a special drill. They were carefully removed without injury to the spinal cord, so that the spinal cord lay completely free in the canal. The roof could now be hinged back into position and was fixed with a wire to keep it in its original position and thereby maintaining the normal outside anatomy of the vertebra. This X-ray was taken just after the surgery and shows the ventral fusion and at the top the wire that keeps the roof together. A brace was also placed around the neck to give some more support to the fixation. This X-ray was taken 6 weeks after the initial surgery. It can be seen that the bone has almost grown together at the top, and at the bottom the bone is filling the defect where the disc was. The first couple of days after the surgery, Luna was still quite weak. This was due to some swelling of the spinal cord. This was all from the surgery itself, but she seemed to be enjoying the attention of the nurses quite a lot. Just look at that tail wagging, much better already than before the surgery. This weakness should only take a couple of days before she should start improving again. Guys, this was when Luna came back for her 6 weeks examination. One can see that the movement has greatly improved and is already much better than before the surgery. Her mood is also quite good. She feels ready to defend her owner again. You can see that this is a very happy dog. 3 months after the surgery, I went to visit Luna at her home together with her brother.